Ever think about having to one day take care of your parents? Well, you probably will have to. Melanie Teat, a registered nurse and director of the home and hospice care at Aurora Visiting Nurses Association, is here to kind of enlighten us about this whole new topic, which a lot of us are finding out that we're going to have to do. Hi, Melanie.
Hi, Amy. Thank you for having me.
Thanks for coming, actually. And this is actually happening in my family right now. My grandmother, who's getting up there in age, can no longer care for herself, so she's moved in with my parents. They live in Arizona, and all sorts of challenges, for sure. And, as we get older and we're living longer, I think a lot of us aren't thinking about, I've got 2 kids right now. I can't even imagine having my parents in my home as well, but I love them, and you do what you have to do, but it's tough.
It is very tough, and that's where I think, those of us, we're considered the sandwich generation now. We're taking care of children at home. We have our parents that are maybe ailing, and many of us work outside of the home, so we're trying to juggle all of that. And that's really where organizations like the Aurora Visiting Nurse Association can help out.
What do you guys do?
We are a nonprofit home care agency that serves people in Northeast Wisconsin. We have everything from skilled nursing, physical, occupational, speech therapy in the home, IV pharmacy, home medical equipment like we'll talk about here, and then we also have hospice and palliative care for those who are nearing the end of life.
Well, I tell you, don't think you can do it yourself, because definitely my parents have relied on visiting nurses and other things to get them through. You think you can handle it, and it's a lot tougher than you think. It's very hard to leave some of these seniors alone. And tell me about this. This is where this comes in. This is amazing. I haven't heard of something like this.
This is an amazing tool that we use in the homes of those who are still living alone.
Okay.
Our goal is to provide intermittent care in their homes and really to keep them as independent as possible. When we're talking about seniors or any of us, many of them are on medications that are required to keep them living well.
A lot of medications.
A lot of medications. And they get a little forgetful. So they may not be able to remember to take their meds. What this does is allows their primary caregiver, maybe their child, to fill this container with their medication doses.
For how long can you fill it up?
90 doses.
Oh, wow.
So it depends on how frequently they're taking meds.
That's great. So it could be up to 3 months.
Could be up to 3 months, depending on if they're taking something once a day. So what this does is it will alert right down here for the patient to take their meds.
Okay.
So alert comes out, says it's time to take your meds.
Right.
If they don't take it, it comes out again, time to take your meds. So it will repeat that notice. If the patient does not come over and press this dispenser button, drop the meds and take them, it will alert the caregiver that set it up. So a phone call goes to them saying, guess what? Your mom didn't take her pill.
That is amazing. Wow.
Now you know to call your mom and say, are you okay?
Right.
Do you need some help? Go take your pills,
right,
etc. So this is really a great
program. And about
$2
a day to rent
about
this.
$2 a day.
My parents need one of those. My dad does the manual filling up of the pill box, once a week. It's tough. Tell me about this phone. Again, another thing, a great thing to have in someone's home, an elderly person's home.
Yep. This is a large button lifeline telephone, and what this does directs calls. If a patient would fall, the old I've fallen and I can't get up, or just has a medical concern, they're not feeling well, they push the button. They can either wear a button around their neck or around their wrist, and now they've come out with a watch, so it's a little bit less intimidating for patients to have this saying, guess what, I need help.
Sure.
So they push the button, they're connected to a live person that talks to them through the phone and says, are you okay? Do you need help? They can call the police, the fire department, whoever they need, or directly to the patient's caregiver as they list as their primary person.
Wow, great
This is
stuff.
about $1 a day.
And so important, really, really important to have. Thanks so much, Melanie. Appreciate it. And if you've got like to contact Melanie or find out more about how their services can help you at Aurora Baycare, you can call 288-5100, 288-5100, or 800-508-5527. Thanks again, Melanie.
Thanks for having me.